Good morning and welcome to another edition of Family First Health's Health Briefings. We take regular opportunities to talk to the community about important health topics, and this morning I'm really excited to be able to have a conversation about HIV testing. Today is National HIV Testing Day, a day to remind all of us how important it is to know our status in regards to HIV, and we have a great panel of folks here to give us more information, talk to us about testing, as well as HIV care in our community. Family First Health currently partners with WellSpan Health under an umbrella program called Caring Together. This program has been in existence for almost 2 decades and focuses on the strengths of each organization in regards to clinical care and supportive services, and really creates a system of care for people with HIV, starting with testing and continuing for people who are positive through treatment, housing support, social and emotional support, a variety of medical care offerings, and we're going to dig into all of that today. We welcome your questions, and we'll be answering those throughout our time together this morning. This year's theme for National HIV Testing Day is Testing is Self-Care, and all of us have probably become a little more aware of opportunities to take good care of ourselves through the course of the last 2.5 years. But this one in particular may not have been on our radar screen. So again, encourage anyone who is interacting with our content today to think about HIV testing. We have a special event today, an offering for free HIV testing on South George Street, right across from Family First Health's building. We have a trailer set up, highly visible, so if you come down South George Street in New York City, you won't be able to miss us. So please feel free to stop by today and get testing, and we'll close with other opportunities throughout the year for HIV testing. I want to get started with the folks on our panel, and actually going to start first by introducing Lisa DeWeese. She's a nurse practitioner with WellSpan Health and has been part of Caring Together for many, many years. I want to welcome Lisa and actually ask Lisa if you can start off by talking a little bit about your role in Caring Together and your experience working within this program.
Sure. Good morning. Thank you for the opportunity to speak today. I appreciate it. I'm a nurse practitioner that has been involved with the Caring Together program since 2001, so about 21 years. And my responsibility would be to take care of patients that are HIV positive and walk them through the journey together in keeping them as healthy as we can. That would include taking their medications every day, making sure that they get their lab work on time, keeping them safe and up to date with all of their other health screenings. It's just a multitude of responsibilities and a partnership with the patients that I have to make sure that they are on point with keeping up with their medications.
So Lisa, could you describe, because one of the things that I think is so special about Caring Together is you have depth and focus in HIV care, and you're a family medicine trained nurse practitioner, right? So could you talk about the inclusiveness of the care that's provided to folks with HIV? So we're not just focused on one thing or one part of their health care. Is that correct?
That is correct. So the Caring Together program focuses on HIV primary care, which is so important because you're right. We don't want to just focus on their HIV. We want to focus on, their health screenings and keeping them up to date with their mammograms and their pap smears and their colon cancer screening. And we want to make sure that they are eating well and they are exercising and they're performing self-care in a multitude of avenues. We treat them for their hypertension. We help control their diabetes. We help control their COPD or their asthma. We absolutely do take care of the whole patient in our program. So that's a wonderful opportunity, because care is then comprehensive and not disjointed.
Absolutely. Thanks for that description. Again, it's what I think is one of the most important and special, unique components of caring together. Natalie, another special and unique component of caring together is having a dedicated pharmacist on the team of experts that really wrap around the individuals with HIV and help support their health journey. Can you tell us a little bit about why a pharmacist is such an important component of the team within Caring Together?
Absolutely. Good morning, everyone, and thank you so much for inviting me to also join the call this morning. HIV care is really, really important to me, and it just holds a really special place in my heart, whether it's through prevention and treatment, and as Lisa said, just working together with the patient and walking with them along this journey. So the importance of a pharmacist, which I feel is very important, is that the pharmacist can partner directly with the providers and also the patient to help with all of their medication needs, whether it's over the counter, answering questions about herbal products and supplements, looking at drug interactions with their currently prescribed HIV treatment medications, and then also talking with the patient to find the best therapy for them, for HIV, for their diabetes, for their high blood pressure, for their COPD, really looking at the patient as a whole. Because as Lisa said, we do provide that comprehensive care. And that value of the pharmacist is really there as the medication expert to help answer any of those questions along the way.
Thanks, Natalie. I'm now going to shift to Helen, who's really our MVP on the call today, or a VIP maybe on our call today. Helen, can you tell us a little bit about your initial testing story, and then your experience traveling this journey, living with HIV, and being part of the Caring Together program?
I was detected 30 years ago, which that was a bad time to have it because they had this medicine that they really were working with, but didn't really know all about it. Like I had tried nasty stuff at first, stuff you drank, and these pills that were huge. And I kept doing it. I kept taking everything I was supposed to and did everything I was supposed to do because of Caring Together and because Clinic and Family First. They were there for me. They helped me through all that. And I never got sick through it. I realized I had it when I was having cold sweats and bones hurting. I went to my doctor down in Florida and got tested. Well, I came up here where I knew they had good people because my one sister was with you. And I'll tell you, if it wouldn't be for like Lisa and my case manager, I would be lost. I would totally be lost. I wouldn't know what I'd do. But I'm glad for them. I'm glad they're here for people. And the Caring Together is like, get in here and get tested today. They care. They're here to help you. Let them help you like they did me. I mean, they're excellent people. They make you feel like family. And that's what we need right now when we have this. We need them there for us, and we need to talk openly with them.
Helen, I think you said a lot of really important things, but I'd like to ask you to go back and maybe share a little more detail about the supports that Caring Together has provided you. You said you'd be lost. So what does that look and feel like? 30 years of living with HIV is tremendous, and that may be surprising to some people. Probably not Lisa or Natalie on the call, but to some people that are watching, they may be surprised by that. So could you talk about some of the role that supports your provider, your healthcare provider, and others have played over time that have really helped you stay as healthy as you have been able to stay?
Well, take your medicine every day is one of the things. Don't miss them, because if you miss it, you're not going to get healthy. You're not going to stay healthy. I mean, your doctor may say to you, been taking all your medicine. Don't tell them, yeah, if you're not. Did you miss any? No, well, maybe you did, and you just don't want to say it. You have to let them know what's going on. I mean, you can't just go out there and act like nothing's wrong. Well, there is until you get undetected. And I've been undetected for years, and I'm grateful for that. But there is scary parts of it, but you'll get over it. They're there to help you through it. I mean, you couldn't have a better team here. I mean, they're just outstanding.
That's great, Helen. And you're obviously an outstanding team member in and of yourself, because you're the one that's doing the work, taking medicine every day, and staying engaged with your healthcare, right? That level of engagement is just foundational, really, for any kind of health challenge that any of us have, and particularly HIV that we're talking about today. You mentioned something that I'm going to actually pass back to Lisa. You said I'm undetectable. And obviously, that's a good thing in the way that you said it, and is a goal when I think about the care that we provide. But Lisa, could you give us a little more insight into what that means and why that is a treatment goal for folks living with HIV?
Sure, absolutely. So, as well as early detection, knowing your status, getting tested, once someone tests positive for HIV, our ultimate goal is to get their viral load, how much HIV virus circulates in their system, to an undetectable level in the blood. Now, that doesn't mean that the HIV is gone from their body. You know, we still have the HIV virus in the body, but these wonderful medications, the antiviral medication, we are able to suppress the viral replication, so it's no longer reproducing in the body, to an undetectable level. Undetectable means that you're preserving your immune function. You're going to stay strong and healthy. You're going to be able to fight off infections or very deadly opportunistic infections in the future with a good, hearty immune function. And when you are undetectable, you no longer can transmit or pass on the virus through unprotected sexual contact, as long as you remain on your medications every single day and your viral load remains undetectable. So you still have the HIV virus circulating, but you don't have that replication. So it's a win-win situation for yourself and your immune function, and for the community for preventing transmission. So it's definitely our ultimate goal to get undetectable and stay undetectable.
Thank you for that explanation. And also sounds like a great reinforcement for people knowing their status or finding out their status early on in the disease process. So as we're here today talking about the importance of HIV testing, want to continue to drive back and underscore how important getting tested is. So let's talk a little bit about testing, how it works, how it happens, and demystify anything that people may be afraid about or concerned about when they're thinking about testing. So Helen, maybe from your experience, just starting out with that importance of testing, and you said you recognized some symptoms, things you were unsure of, and then that drove you to be tested. What would you say to other folks who are kind of sitting on the fence today, unsure about going through with the process of testing?
Don't be unsure. Get tested. Be sure. I mean, what if I wouldn't have went, you know? I mean, I could have gotten sick and all kinds of things over this, but I knew something was wrong. When he tested me and said I'm positive, I came back to York, because I knew they had good doctors up here for HIV. So
and then you've had
go ahead.
30 years worth of memories and interactions with your family and friends, and challenges, I'm sure, but a long, healthy life with HIV. So really important for people to know what's possible versus things that they may have heard or rumors. You're a great example of what can happen when you take a step to be tested and know your status.
Well, I can tell them right now, it used to be it was a death sentence. Everybody said that. Well, no, it's not anymore. They have improved so much of the medicine, and they have used all there to help us through all this. And as long as you got support, you'll make it through it. You'll make it 30, 40, 50 years. I did.
Yeah,
You
thank
can.
you for that, Helen. Lisa, could you talk us through the particulars? Is this a blood test? I've also had people ask questions about there's so much more home testing available, and HIV is one of those things that we can test for at home. Can you give us the rundown of the logistics? What does it look like for people if they're considering testing?
Yes. So when you present to a healthcare provider, they may order a blood test and they send it out to the lab. And then that process usually takes about 24 to 48 hours. But you may also walk into organizations such as Family First Health and get a rapid finger stick blood test, which gives you a result in about 20 minutes. And then if that would be reactive, then we would order confirmatory blood testing just to make sure. There is also an oral swab that you can do, and the home kits are readily available. And I think the website was on our slide presentation in the very beginning. And they are mailed directly to your home. The importance with that is if you do a home test and it would be positive, to seek care at a healthcare provider for follow-up testing and engagement in care.
Great. Thanks for that rundown. So as simple as a finger stick, test can be administered at home, but that importance of following up with a healthcare provider should that test result be positive. Thank you for that. Natalie, I wonder as we think about days where we recognize the progress that we've made with HIV care. And I think this is certainly one of those opportunities, progress with testing and certainly treatment we've talked about a bit. Can you talk about the satisfaction that you find in your profession being able to work with this population and how your role has impacted lives?
Sure. I just want to say, I think my life has been probably impacted the most by working with our patients. Any little bit that I can give back to serve this community that also raised me, I'm from York County, is just very, very special. So I just want to say with Helen, as she had mentioned, her history with taking medication from the very beginning and how much has changed compared to today. And I'm sure Helen will be able to explain that in even more detail from her personal experiences, just how challenging it was when she was first diagnosed compared to now where she's able to take, a single tablet once a day. Pharmacy, we've seen really a lot of different pivot points in history of HIV treatment and even prevention, where we've gone from these very, very complex, awful tolerated regimens to now having very well tolerated single tablet regimens. So what I mean by a single tablet regimen is instead of having to take multiple pills multiple times a day, we now have the opportunity to take one pill once a day. And that's really what I think from seeing from patients, from hearing stories, just how life-changing that is. And I'm sure Helen would say the same.
Yeah.
Yeah. And then also with HIV treatment now, we're seeing another pivot point in history where we're moving even from those oral treatment options to injectable treatment options. And there are more in the pipeline coming in the next couple of years. So this is a really exciting time for treatment and for working towards ending the HIV epidemic. And I really do believe in the near future, we're going to continue to see cases decreasing and folks with HIV living even longer lives because we're giving them that comprehensive care, looking at all their medications, the whole person, the whole body. It's really exciting, and it's been an honor just to serve in this program.
Thanks, Natalie. And I think your point about the continued advancements and investments that have been made in helping HIV move from a situation where it was very difficult to diagnose and treat and understand, to one where we can potentially think about it as a chronic manageable disease, is a real game changer over a relatively short amount of time, for decades. So, Helen, do you want to talk about what your daily routine looks like, as far as what you need to do to keep yourself as healthy as possible with HIV?
It's mainly your medicine. And then I'd say exercise, walk, or something like this, you know. And I like walking, but I haven't done much of it lately, my bag. But I mean, it's just take care of yourself. Listen to your doctors, listen to your case managers. They know, they've been in this business, and be thankful for them because they're there for you. Just keep your health up. Don't miss medicine. I stress that because I know. Don't.
And that's not always easy, right, Helen? I mean, there are things, particularly right now you've shared it's one tablet a day, but that hasn't always been the case for you. So that hasn't been easy over time. So what has it been like for you when there's been a tough week, or maybe you've missed a dose, or you've had something that's disrupted? How do you kind of get back on track?
Just start right back, and don't lie to your provider. If they ask you if you've missed a dose, tell them. Don't be afraid they're going to holler at you, because they're not. They'll work around it with you.
I think that's a really important point, Helen, and could be extended to so many different chronic illnesses, right? That honest and open dialogue with your provider is really what's going to be the key to success in the long run.
Yeah.
I also wanted to talk, Helen, a little bit about, you mentioned case management, and Lisa and Natalie do perform in their roles within the Caring Together program. And then we have another part of the team that we haven't focused on yet. And those are case managers. So can you tell us a little bit about what case management has been able to provide you over the years and working with Caring Together?
Well, they provide me with a lot of things. They provide me for food. If you need food, they'll provide for that. And anything you may need, if you need to get a hold of some kind of organization or something, they're there to help you get with who you need to get with. I mean, it's not just HIV. It's like other things that you have to do. They're there to help you. They know more than me. I get confused sometimes. And I'll go station and say, oh, I need this done. I can't do it. And now with me going blind, it's pretty hard because I can't really read that well. But the station's right there to help me. She's an excellent case manager.
That's great. I think it makes me think about when you said that you would have been lost without Caring Together. I think the role that case managers play kind of particularly zooms in on that navigation and making sure that people don't get lost in the confusion of trying to navigate services or other aspects of their life. And as you've said, you've noted several things that also go on in your life. People with HIV aren't just focused on HIV all day, every day. So it's all the other things that go on in life that kind of help us be healthy or make it a little more difficult. And that's where case managers can really help navigate and support.
Could I just add, Jenny, that the case managers can also help with housing issues and needs that may come up. They can help with some transportation needs and issues if clients are struggling with that. Definitely, they are a great emotional and mental support for our clients as they navigate this journey. So they are very, very appreciative and thankful for all their dedication and hard work.
Thanks for that, Lisa. As we've talked a lot about all the services available with Caring Together. We've talked a bit about the transitions that we've noted in HIV care and how important they are, the long life that people living with HIV today can expect. and the roles that people play, both patients, people living with HIV, and the care teams. But today, I'll just remind us that we're here to focus on people knowing their status and getting tested. So I'm going to ask everybody for some final words of support for anybody who's out there on the fence today that may come across this program or other messages and reminders about getting tested. So Lisa, we'll start with you. What would you say to somebody who it might kind of prompt them to find out their status today?
Yeah. I love the saying, knowledge is power. So knowing may be scary, but knowing is absolutely extremely important in getting the care that people need and deserve as fast as possible. So get tested. Don't just get tested once, get tested now, today, down at Family First Health. Get tested if you have any new sexual encounter, any exposure with IV drugs. Just get tested, know your status, knowledge is power.
Thanks, Lisa. Natalie, how about you?
Yes, I just want to echo that knowledge is power. And also testing is an act of self-care. So we test for other things, diabetes, high blood pressure, routinely. This is just another routine test that's important and is life-saving. So knowing your status early on, getting connected with the right care, getting connected with a provider, a case manager, to get just all those other access points that we talked about is huge. And I know it may be scary thinking about, oh no, what if I am positive? What does that mean for me? Next steps. It's going to be okay. We are here for you. We are more than happy to be your support system and help to tailor treatment to you. So this is not a one size fits all thing. This is going to be tailored to you and what your needs are. So I just encourage you and ask you to please get tested.
Thanks, Natalie. I'll remind everybody before I turn it over to Helen for some last words that we are doing free testing all day today right at City Hall in New York City. So across the street from Family First Health building, there's a very visible Family First Health trailer out there. So you won't miss us. So June 27th, today, all day, stop down, get tested, and learn more about HIV in the process. So encourage you to take advantage of that. And then know any day, you can check out our Family First Health website, and we offer regular testing hours every day of the week. And so please feel free to follow up outside of today as well. And just a reminder, we'll be there till 3:30 today, and please come join us. I think the sun is going to come out this afternoon. And so please come join us and find out your status in a free and confidential setting. Helen, I'm turning it over to you for some final words.
Gee, thanks. I'm telling everybody to come in today. If you don't know, or if you think you might have been with somebody, come in. I mean, nobody's going to know nobody says anything. This is like a private thing here. We don't tell anybody anything. We don't have the right to do that at all. But come in, get tested. You got all these people waiting to help you, and you got a good team here. So get in and let them talk to you. If you're positive, they're positively going to be here for you. So get in and get with them and get tested, please. Don't wait too long.
Thank you, Helen. Those were the perfect words to close us out. Thank you for sharing your story with us today and providing the hope that someone who's living with HIV for 30 years provides to someone who may not have been able to have that vision. Yeah. Thank you to Lisa and Natalie for your contributions to Caring Together and the whole Caring Together team, our case managers, folks doing testing, eligibility assistance, other providers within our program. It is a really great team that I'm proud to work with every day. So know your status today, come and get tested. And thank you all for joining us this morning.
Thank you for asking me to join. It's over.